Welcome to a new episode of our AI podcast. Today on this episode, you know what shocked me last week? A patient came in, 58 years old, perfect health by all accounts, but he's been getting up 4 times a night to pee for 2 years.
4 times? Shit, meta. 6, 1.0. That's not just inconvenient, Michael. That's a red flag.
Exactly. And here's the thing that gets me. He thought it was normal. I'm over 50. What do you expect? He said.
In Japan, we have a saying, 6, 0.5. The body whispers before it shouts. He was ignoring the whisper.
And that's exactly what we're talking about today. Because half of men over 50 are dealing with prostate issues, but most are suffering in silence.
We're going to share 5 natural methods, no pills, no surgery, that can actually make a difference.
And I'm talking about real results. We've seen men reduce nighttime bathroom trips from 4 times to once, sometimes 0.
Without medication. Just simple changes that work with your body, not against it.
But first, we need to talk about the elephant in the room. Why do so many men ignore these symptoms?
Embarrassment, fear, and in many cultures, the belief that suffering is just part of aging.
Which is complete nonsense. Your prostate is not supposed to wake you up 4 times a night.
It's a gland about the size of a walnut, sitting right below your bladder. When it swells, it squeezes the urethra.
And that's what causes the symptoms. Weak stream, frequent urination, that feeling like you can't fully empty your bladder.
For most men, this is benign prostatic hyperplasia, BPH. Not cancer, just enlargement.
But here's what nobody tells you. It's not inevitable. There are men in their 70s with 0 symptoms.
So what's the difference? That's what we're going to explore today. Starting with something you probably have in your kitchen right now.
All right, Hiroshi, you've been telling me about this tomato thing for months. Time to explain it.
Lycopene. It's a powerful antioxidant found in tomatoes, and the research is remarkable.
I've seen the studies. There was one from Osaka University that followed 26,000 men over a decade.
Yes. Men who ate tomato-based foods 5 or more times per week had a 28% lower risk of prostate enlargement.
28%? That's significant. But here's where it gets interesting. It's not just about eating raw tomatoes.
Exactly. Lycopene is fat-soluble, which means your body absorbs it better when tomatoes are cooked with a little olive oil.
So we're talking tomato sauce, not tomato salad.
Precisely. In Japan, we simmer tomatoes into soups and stews. The heat breaks down the cell walls, releasing more lycopene.
And I tell my patients, a tablespoon of olive oil with your pasta sauce isn't just for flavor. It's helping your body absorb the lycopene.
One of my patients, 62 years old, started eating tomato-based meals 4 times a week. Within 3 months, his nighttime urination dropped from 3 times to once.
I've seen similar results. But let's be clear, this isn't a magic bullet. It takes consistency.
At least 3 to 4 months. The prostate doesn't change overnight.
So what's the minimum effective dose? How much are we talking about?
Studies suggest 10 to 15 milligrams of lycopene per day. That's about 2 tablespoons of tomato paste or a cup of tomato sauce.
Easy to incorporate. Morning eggs with salsa, lunch with tomato soup, dinner with marinara sauce.
And here's a bonus. Lycopene also supports heart health and reduces inflammation throughout the body.
Now the second method is something a lot of guys get wrong. We're talking about exercise.
Wrong how?
They think more is better. I had a patient, 55, training for a marathon. His prostate symptoms were getting worse, not better.
The pressure. Long-distance cycling and running can actually irritate the prostate.
Exactly. Sitting on a bike seat for hours, that's constant pressure on the perineum, right where your prostate is.
So what works better? In Japan, we have a practice called Ragyo Taiso, radio exercises. Gentle, consistent movement.
I've seen videos of that. Looks like a mix of stretching and calisthenics.
It's designed to improve circulation without strain. And here's the key. It includes pelvic tilts and hip rotations,
which increases blood flow to the pelvic region. That's crucial for prostate health.
Poor circulation means less oxygen, more inflammation. The prostate needs fresh blood, just like any other organ.
So what's the American equivalent? Not everyone's going to do Japanese radio exercises.
Walking, 30 minutes a day, 5 days a week. But with intention, engage your core, swing your arms.
And here's something I recommend. After every hour of sitting, stand up and do 5 squats.
Yes, squats are excellent. They activate the pelvic floor muscles and increase circulation.
You don't need a gym, just body weight squats, controlled movement, focus on form.
5 squats every hour. That's 50 squats in a workday. Small effort, significant impact over time.
Now we need to talk about something that might surprise people. Stress is destroying your prostate.
The mind-body connection. In Western medicine, this is often overlooked.
Because we're trained to treat symptoms, not root causes. But the data is clear. Chronic stress elevates cortisol.
And cortisol triggers inflammation. Inflammation swells the prostate tissue.
I've seen men with perfect diets, exercising regularly, still dealing with severe BPH. Why? Stress.
My father dealt with this. He was a businessman, high pressure, always tense. His prostate symptoms started at 52.
What changed for him?
He started a daily tea ceremony practice. Not the formal kind. Just 15 minutes each evening to prepare and drink tea mindfully.
So essentially meditation, but with a ritual structure.
Exactly. Within 6 months, his nighttime urination decreased from 4 times to 2.
There's a study from UCLA that backs this up. Men who practiced 20 minutes of daily meditation showed a 23% reduction in inflammatory markers.
The key is consistency. Not marathon meditation sessions on weekends. Small daily practices.
For my American patients, I recommend box breathing. 4 seconds in, hold 4, out 4, hold 4.
Simple but effective. You can do it at your desk, in traffic, before bed.
And here's something people don't realize. Laughter reduces cortisol too. Social connection, humor, play.
In Japan, we have laughter yoga groups for seniors. It sounds silly, but the benefits are real.
All right, number 4. This one's controversial, Hiroshi, and I know we disagree on the details.
Zinc supplementation.
Zinc. The prostate has the highest concentration of zinc in the entire body.
Yes, zinc regulates prostate cell growth and has anti-inflammatory properties.
But here's where we part ways. I tell patients to get zinc from food, oysters, pumpkin seeds, beef.
And I agree, food is best. But for men over 60 with absorption issues, a 15 milligram supplement can be helpful.
Can be, but too much zinc interferes with copper absorption. I've seen patients overdo it.
You're right to be cautious. That's why I never recommend more than 15 milligrams, and always with food.
Here's what I tell guys. Try food sources first. 3 ounces of oysters give you 74 milligrams.
A quarter cup of pumpkin seeds has about 2.5 milligrams. Easy to add to salads or oatmeal.
And if you're eating a varied diet with meat, nuts, and seeds, you're probably getting enough.
But if you're a vegetarian or vegan, supplementation becomes more important.
Fair point. In that case, work with your doctor to check your levels first.
Blood tests are simple. If you're deficient, supplementing makes sense.
But never exceed 40 milligrams per day from all sources combined. That's the upper limit.
And most men won't need that much. Small amounts, consistently, over months. That's how zinc works.
Now the fifth method is the one most men mess up completely, and it's about timing.
Fluid intake?
Fluid intake. I can't tell you how many guys chug water all day, then wonder why they're up 4 times at night.
The bladder doesn't distinguish between water, coffee, or beer. Liquid is liquid.
And if your prostate is already squeezing your urethra, adding more fluid at the wrong time makes it worse.
In Japan, we have a rule, the 6 p.m. cutoff. No large amounts of fluid after 6 p.m.
That's reasonable. I tell patients to front load their hydration. Drink most of your water before 4 p.m.
This gives your kidneys time to process the fluid before you sleep.
And here's the thing, you still need adequate hydration. Concentrated urine irritates the bladder.
Exactly. It's not about drinking less total, it's about timing.
I also tell guys to avoid alcohol after dinner. It's a diuretic and a bladder irritant.
Same with caffeine. That evening, coffee or tea, it's sabotaging your sleep.
I had a patient who swore by his post-dinner coffee. Gave it up for 2 weeks, nighttime urination dropped by 50%.
Small change, dramatic impact. That's the power of timing.
And if you're thirsty in the evening, small sips are fine. We're talking about chugging 16 ounces before bed.
Your body will adapt. Give it 2 to 3 weeks and you'll notice the difference.
All right, we've covered 5 methods, but Hiroshi and I need to be clear about something important.
These natural approaches work for benign prostatic hyperplasia, BPH, not for everything.
If you're seeing blood in your urine, having pain, or experiencing sudden changes, you need to see a doctor immediately.
These symptoms could indicate infection, stones, or in rare cases, cancer.
And I don't care how much lycopene you're eating, you still need regular screening. PSA tests, digital exams.
Prevention and early detection are different things. You need both.
The methods we discussed today are for maintenance and mild to moderate symptoms.
But they're powerful. We've both seen men avoid medication by making these changes.
It takes 3 to 6 months to see results. This isn't a quick fix.
Consistency is everything. Small daily actions compound over time.
And if you're already on medication, don't stop without talking to your doctor.
These natural methods can work alongside medication, often reducing the dose needed.
But that's a conversation with your physician, not something you decide on your own.
Your doctor is your partner in this. Share what you're doing. Track your symptoms.
Most doctors appreciate patients who take an active role in their health.
And if your doctor dismisses natural approaches entirely, it might be time to find one who's more open-minded.
You know what's interesting, Hiroshi? We've talked about 5 methods, but there's a common thread.
Inflammation?
Inflammation. Every single method we discussed reduces inflammation in some way.
Lycopene is an antioxidant. Exercise improves circulation. Stress management lowers cortisol.
Zinc regulates immune response. Proper hydration prevents irritation.
It's all connected. The body is not separate systems. It's one integrated whole.
And that's where Western medicine sometimes misses the mark. We treat the prostate like it exists in isolation.
But your prostate health reflects your overall health. Poor sleep, chronic stress, inflammation everywhere.
So when patients ask me which method is most important, I tell them it's not about picking one.
It's about building a lifestyle that supports your whole body.
Start with 1. Add tomatoes to your diet this week. Then add walking next week.
Layer the changes. Don't try to overhaul everything at once.
I had a patient who tried to do everything simultaneously. Lasted 3 days, then quit completely.
Sustainable change is gradual change. one habit at a time.
And here's the good news. Small improvements create momentum. Success breeds success.
Your body wants to heal. Give it the right conditions and it will surprise you.
Let's talk about tracking, because if you can't measure it, you can't improve it.
Yes, keeping a simple log makes a huge difference.
I tell patients to track 3 things: nighttime urination frequency, stream strength, and sense of bladder emptying.
And in Japan, we also track energy levels and mood. They're all connected to prostate health.
You can use a simple notebook or your phone, just 30 seconds before bed.
The key is consistency. Track for at least 8 weeks to see patterns.
And don't get discouraged if progress is slow. Some weeks you'll see improvement, others you might plateau.
That's normal. The body doesn't change in a straight line.
I had a patient whose nighttime urination actually got worse in week 3, then dramatically improved in week 5.
The body was recalibrating. Sometimes healing looks like getting worse before getting better.
But if symptoms worsen significantly or persist beyond 3 months, see your doctor.
Natural methods take time, but they shouldn't make things worse.
And bring your tracking log to your appointment. Doctors love data.
It shows you are engaged in your health, not just complaining about symptoms.
Plus, you'll spot patterns you might otherwise miss, like symptoms worsening on stressful days.
Knowledge is power. The more you understand your body, the better you can care for it.
Before we wrap up, there's one thing Hiroshi and I disagree on, and I think it's worth discussing.
Saw palmetto.
Saw palmetto. You swear by it, I'm skeptical.
The research is mixed, I'll admit, but I've seen it help many patients.
The problem is quality control. Most supplements aren't standardized.
You're right. If someone tries saw palmetto, they need a reputable brand with third-party testing.
And to be fair, some studies do show benefit. A 2012 Cochrane review found mild improvement in urinary symptoms.
The key word is mild. It's not a miracle cure, but for some men, it helps.
If you try it, give it 3 months. And tell your doctor, especially if you're on blood thinners.
Saw palmetto can interact with certain medications. Always disclose supplements to your physician.
My stance is, try the 5 methods we discussed first. They have stronger evidence.
That's fair. Saw palmetto is supplementary, not primary treatment.
What about beta-sitosterol? That's another one I hear about.
Similar to saw palmetto. Some evidence, but not overwhelming. Found in pumpkin seeds and soybeans.
So again, food sources first. If you're eating pumpkin seeds for zinc, you're getting beta-sitosterol too.
Exactly. Nature packages nutrients together for a reason. Whole foods beat isolated supplements.
All right, let's bring this home. 5 natural methods for prostate health.
Lycopene from cooked tomatoes, at least 4 times per week.
Movement that increases pelvic circulation. Walking, squats, gentle exercise.
Stress management through daily practices. Meditation, breathing, rituals.
Adequate zinc from food sources or a 15 milligram supplement if needed.
And proper fluid timing. Front load hydration. Minimal intake after 6 p.m.
Start with 1. Build from there. Give yourself 3 to 6 months.
And remember, these methods support your overall health, not just your prostate.
If you have concerning symptoms, blood, pain, sudden changes, see a doctor immediately.
But for most men with mild to moderate BPH, natural approaches can make a real difference.
We'd love to hear from you. Have you tried any of these methods? What worked?
Share your experience in the comments. Your story might help someone else.
And if you found this helpful, subscribe. We're doing an episode on sleep quality next week.
Which, as it turns out, also affects prostate health.
Of course it does. Everything's connected.
Take care of yourselves and each other.